Have you ever noticed how a single health headline can make your breathing feel tighter, even before you understand what it really means? One of my patients once shared that what frightened her most was not feeling short of breath, but hearing the words respiratory failure without anyone explaining them calmly. I want you to imagine this for a moment. You are sitting comfortably, listening to a steady voice that helps your body relax instead of putting it on alert. I am Dr. Evelyn Carter, and for many years I have cared for older adults who want clarity, not alarm. When people hear phrases like respiratory failure, it can sound sudden and uncontrollable. From real clinical and caregiving experience, I have learned that fear often comes from uncertainty, not from actual danger. When the body does not understand what is happening, the mind fills in the gaps. Let me gently reassure you early on. Nipah virus is rare and not part of everyday life here in the United States. Most seniors are not facing immediate risk. Respiratory failure is a medical term doctors use to describe a serious condition they monitor carefully over time. It does not appear out of nowhere. It develops through signs and patterns that physicians are trained to recognize long before it becomes severe. The purpose of this video is not to alarm you. It is to help you understand what doctors truly mean when they talk about respiratory risks. We will talk about how breathing changes are observed calmly, how timing and overall function matter more than isolated sensations, and why steady awareness protects health far better than constant worry. For today, understanding alone is enough. You do not need to change your routines or watch your breathing all day. Your body responds best to steadiness, familiar rhythms, and emotional safety. Think of this as a quiet conversation with a physician who respects your pace, your dignity, and your life experience. If this kind of calm, respectful guidance feels helpful, please take a moment to subscribe, like, and share Senior Health Daily. Your support allows us to continue creating thoughtful health conversations made especially for you. In the next part, we will move slowly through how respiratory risks are assessed, which symptoms truly matter, and how seniors and caregivers can stay informed without fear. What doctors mean by respiratory failure. When doctors use the term respiratory failure, it can sound frightening, especially if it is unfamiliar. I want to slow this down and explain it in a way that feels clear and grounded. In medical terms, respiratory failure means the lungs are not exchanging oxygen and carbon dioxide as efficiently as the body needs. It does not mean breathing suddenly stops, and it does not describe a single moment. It describes a process doctors observe through patterns. In everyday practice, we look at how well oxygen is moving from the lungs into the blood and how effectively carbon dioxide is leaving the body. This exchange supports energy, clear thinking, and organ function. When that exchange becomes less effective over time, doctors pay attention. This change usually develops gradually and with signs that can be measured and observed. What respiratory failure is not is just feeling short of breath after activity or having a bad night of sleep. Many older adults experience temporary breathlessness due to fatigue, anxiety, posture, or mild illness. Those experiences are common and often resolve with rest and routine. Respiratory failure involves persistent changes that affect daily function, oxygen levels, or alertness, not fleeting discomfort. From my clinical experience, the most important word here is pattern. Doctors watch how breathing feels at rest and with gentle activity, whether energy is returning or fading, and whether mental clarity stays steady. We consider sleep quality, hydration, and recent illnesses. We also look at how a person feels compared to their usual baseline. This broader view protects patients from unnecessary fear and unnecessary treatment. Another important point is timing. Respiratory failure does not arrive without warning. The body signals changes over days and sometimes weeks. These signals allow healthcare teams to respond thoughtfully. That response may include monitoring, supportive care, or simple adjustments that help the lungs work more comfortably. Sudden emergencies are rare and clearly different in presentation. For seniors, understanding this definition brings relief. It means you do not need to interpret every sensation as a crisis. Awareness does not require vigilance. It requires calm observation and communication with your healthcare provider when something feels truly different from your norm. When doctors talk about respiratory failure, they are describing a clinical condition with specific criteria, not predicting an outcome. Their goal is to support the body early and gently. This careful approach respects dignity and reduces anxiety. As we continue, keep this foundation in mind. Respiratory failure is a medical term rooted in observation and timing. It is not a sudden label and not a reason for fear. It is a way doctors ensure breathing is supported with care, patience, and clarity. Why respiratory risks sound scarier than they are. When people hear the word risk, especially connected to breathing, it often lands with much more weight than it deserves. I have seen this many times in my practice. A patient hears that there is a respiratory risk, and immediately the mind jumps to certainty. Something bad is going to happen. That reaction is very human, but it is not how doctors use the word. In medicine, risk describes possibility, not prediction. It means something could happen under certain conditions, not that it will happen to you. Doctors talk about risk the same way meteorologists talk about weather. A chance of rain does not mean your house will flood. It means conditions are being watched. This distinction is especially important for older adults who have lived long enough to know that not every warning turns into reality. Medical language can feel overwhelming because it is designed to be precise, not comforting. Terms like respiratory risk or respiratory failure are used to communicate clearly between professionals. When those same words reach the public without explanation, they can sound harsh and absolute. Seniors often tell me that the words themselves frighten them more than how they actually feel in their bodies. From years of clinical experience, I have learned that many older adults misinterpret risk as a timeline. They hear a risk mentioned and assume something is about to happen soon. In reality, risk often refers to long-term observation. It helps doctors decide what to monitor gently over time, not what to treat urgently today. Another reason respiratory risks feel so alarming is that breathing is deeply emotional. When breathing feels threatened, even in thought, the nervous system reacts. Heart rate increases, muscles tighten, awareness narrows. This reaction can make normal breathing feel more difficult, creating a cycle of worry that has nothing to do with lung function itself. Doctors are trained to separate emotional response from physical measurement. We look at oxygen levels, breathing patterns, stamina, and recovery. These objective signs guide care far more than fear ever could. When those measurements are stable, risk remains just that, a possibility being watched, not a prediction unfolding. For seniors, understanding this difference can be liberating. It allows you to hear medical language without absorbing it as personal danger. You can ask questions calmly. You can stay engaged in your routines. You can trust that risk is being monitored professionally and quietly. Risk is not a verdict. It is a tool doctors use to protect health early and gently. When you understand that, the word loses its power to frighten. It becomes what it was always meant to be, a signal of careful attention, not a cause for alarm. How Nipah virus can affect the lungs. When we talk about how Nipah virus can affect the lungs, it is important to begin with perspective. In a small number of cases, this virus has involved the respiratory system. That word small matters. Most people, especially seniors living in the United States, will never encounter this virus in daily life. Doctors emphasize this rarity because it shapes how we think, how we monitor, and how we respond calmly. In the cases that have been studied, respiratory involvement does not appear as a sudden collapse of breathing. It develops through observable changes. Doctors pay attention to how breathing feels at rest, how it responds to gentle movement, and whether fatigue is improving or lingering. These observations are made over time, not in a single moment. From a medical standpoint, the lungs are part of a larger system. When they are under stress, the body often gives subtle signals. A person may notice they tire more easily during activities that were once comfortable. Recovery after walking or climbing stairs may take a little longer. Sleep may feel less refreshing. These are the kinds of changes physicians watch carefully, always comparing them to a person's usual pattern. Oxygen levels are another important guide. Doctors use simple, non-invasive tools to see how efficiently oxygen is moving into the blood. These measurements help distinguish between temporary breathlessness and a true problem with gas exchange. In many situations, oxygen levels remain stable even when a person feels tired or anxious. That stability is reassuring and helps guide gentle care. Fatigue often plays a central role here. It is one of the most common sensations older adults report, and it can come from many sources. Poor sleep, dehydration, emotional stress, and mild infections can all contribute. When Nipah virus has involved the lungs, fatigue tends to follow a pattern. It does not come and go randomly. It persists and often deepens alongside other measurable changes. This pattern is what doctors look for. I have cared for many seniors who worried that feeling winded meant something serious was happening. In most cases, their breathing returned to baseline with rest, routine, and reassurance. That experience reflects why doctors emphasize observation over reaction. The body often recovers quietly when given time and support. Understanding how Nipah virus can affect the lungs is not about anticipating danger. It is about recognizing how physicians think and why they move slowly and thoughtfully. Respiratory involvement is monitored through patterns of breathing, oxygen exchange, and daily function. When these remain steady, there is room to breathe easily, both physically and emotionally. This careful approach allows seniors to stay grounded in their lives. It reinforces the truth that rare possibilities are watched professionally, while daily well-being is supported through calm awareness and trust in the body's signals. Early respiratory changes versus normal aging. One of the most common concerns I hear from older adults is this simple question: how do I know what is normal aging and what deserves attention? This question matters because many changes that come with age can feel unfamiliar, even when they are not dangerous. As we grow older, the body naturally asks for a slower pace. Muscles, including those involved in breathing, may feel less responsive during exertion. You might notice shortness of breath when walking uphill, climbing stairs, or carrying groceries. Recovery may take a little longer than it did years ago. These changes are expected and often reflect conditioning, posture, and overall stamina rather than lung disease. Temporary fatigue is another common experience. A poor night of sleep, dehydration, emotional stress, or even changes in routine can leave an older adult feeling unusually tired. This kind of fatigue often improves with rest, hydration, and returning to familiar rhythms. It does not steadily worsen, and it does not interfere with basic daily function over time. Early respiratory changes that concern doctors look different because they follow a pattern. Instead of improving with rest, breathing may feel consistently more labored, even during quiet activities. Fatigue may deepen rather than lift. A person may notice that tasks they could manage easily last week now feel unusually difficult. These changes tend to persist and gently progress rather than fluctuate. Context is essential here. Aging bodies respond differently to activity and recovery, but they also communicate clearly when something is off. Doctors compare how you feel now to how you usually feel, not to how you felt decades ago. This comparison helps separate normal aging from something new. I often reassure patients that noticing changes does not mean something serious is unfolding. It means the body is being listened to. Awareness becomes a problem only when it turns into constant worry. Calm observation allows real signals to stand out without amplifying everyday sensations. Breathing is also deeply connected to emotion. Anxiety can make breathing feel shallow or tight, even when lung function is normal. This is especially true when someone has read or heard alarming information. Once fear settles, breathing often feels easier again. That shift itself is informative. Understanding the difference between early respiratory changes and normal aging restores confidence. It allows seniors to stay active and engaged without fear. When changes are placed in context, the body feels less like a mystery and more like a familiar companion adapting to time. This perspective protects dignity and independence. It reminds you that aging is not decline, but adjustment. With calm awareness and trust in medical guidance, seniors can continue living fully while knowing that meaningful changes will be recognized clearly and addressed thoughtfully if needed. When breathing symptoms truly need medical attention. One of the most helpful things I can offer is clarity about when doctors actually want to hear from you. Many seniors worry about bothering their physician, while others fear they might wait too long. The truth sits gently in between, and it is guided by patterns rather than moments. Doctors pay close attention to persistence. A brief episode of breathlessness that improves with rest is very different from breathing that feels difficult day after day. If a symptom lingers and does not ease with sleep, hydration, or a return to routine, that is when we want to know. Persistence tells us the body may need support. Worsening function is another important signal. We look at what you can do comfortably compared to your usual life. If walking across a room, preparing a meal, or having a conversation becomes noticeably harder than it was recently, that change matters. It is not about comparing yourself to others. It is about comparing today to your own normal. Changes from baseline are especially meaningful for older adults. Every person has a unique rhythm. Some people walk slowly but steadily. Others tire easily but recover well. Doctors want to know when that familiar rhythm shifts. If breathing feels different in a way that stands out to you, that awareness is worth sharing calmly. We also consider the whole picture. Breathing symptoms accompanied by ongoing fatigue, confusion, or reduced alertness deserve attention. These combinations help doctors understand whether the lungs are struggling to support the body effectively. It is rarely one symptom alone that guides care. It is how symptoms come together over time. What doctors do not expect is constant reporting of every sensation. Temporary shortness of breath during exertion, especially in warm weather or after poor sleep, is common. Anxiety can also make breathing feel tight without reflecting lung trouble. These experiences often resolve when the nervous system settles. From my clinical experience, seniors sometimes delay reaching out because they fear bad news. In reality, early communication often leads to reassurance rather than intervention. When doctors hear about changes early, we can assess calmly and support the body before stress builds. Caregivers can use the same approach. Notice whether a loved one's breathing affects comfort, safety, or participation in daily life. If it does, sharing that observation is helpful. You do not need to diagnose. You only need to describe what has changed. Medical attention is not about urgency alone. It is about partnership. When you understand what doctors look for, you can reach out with confidence rather than fear. That confidence supports timely care, emotional safety, and continued independence. Knowing when breathing symptoms truly need attention allows seniors to live without constant vigilance. It replaces guesswork with trust, helping you stay grounded in your life while knowing support is always within reach when it is genuinely needed. Staying informed without becoming anxious. One of the quiet challenges of our time is not a lack of information, but an excess of it. Health news arrives quickly and often without context. For many older adults, this constant flow can feel overwhelming, especially when the topic involves breathing or serious medical language. I have spoken with countless seniors who told me they felt more anxious after reading updates, even though nothing had changed in their own bodies. Information overload affects emotional health in very real ways. When the mind is repeatedly exposed to urgent or dramatic messages, it stays on high alert. Sleep becomes lighter. Breathing feels less steady. Normal sensations feel magnified. This reaction is not weakness. It is the nervous system responding to perceived threat. Over time, this stress can make the body feel more fragile than it actually is. From a medical perspective, anxiety itself can influence breathing patterns. Shallow breaths, chest tightness, and fatigue often appear when worry rises. These sensations can then be mistaken for illness, creating a cycle that feeds itself. This is why how information is received matters as much as what the information says. Staying informed should feel supportive, not unsettling. It means choosing sources that explain calmly and stepping back from those that provoke fear. It also means allowing yourself to absorb information at a pace that feels manageable. You do not need to follow every update to take good care of yourself. Awareness does not require constant attention. I often encourage patients to return to their own daily experience as their anchor. How do you feel this morning compared to your usual self? Are you moving, breathing, and resting in familiar ways? When daily life feels steady, that steadiness carries more truth than any headline. This is why Senior Health Daily exists. The goal is to create a space where information arrives with care and respect for the aging body and mind. Calm explanations allow understanding to settle without stirring anxiety. Many seniors tell me that returning to a familiar voice and a steady tone helps them feel grounded again. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. You are allowed to step away from constant updates. You are allowed to protect your peace. When information supports calm, the body responds with steadier breathing, clearer thinking, and better rest. That balance is not only healthy, it is essential for aging with confidence and dignity. Daily habits that support respiratory health. When it comes to respiratory health, the most powerful support often comes from simple daily habits that are already within reach. Over the years, I have seen again and again that the body responds best to consistency. Gentle routines give the lungs, muscles, and nervous system a sense of safety, and that sense of safety allows breathing to feel easier and more natural. Regular movement is one of the quiet foundations of healthy breathing. This does not mean strenuous exercise. It means steady, comfortable activity that encourages the lungs to expand and contract in a natural rhythm. Walking at your own pace, light stretching, or moving around the home throughout the day helps keep the chest flexible and supports circulation. When movement is familiar, the body knows what to expect, and breathing often follows more smoothly. Hydration plays a role that is often overlooked. When the body is well hydrated, mucus in the airways stays thinner and easier to clear. Dehydration, even mild, can make breathing feel heavier and contribute to fatigue. Drinking fluids regularly throughout the day supports not only the lungs, but overall energy and clarity. Posture is another gentle but important habit. Slouching or sitting for long periods can restrict how fully the lungs expand. Sitting upright, allowing the shoulders to relax, and giving the ribcage room to move can make a noticeable difference. Many seniors tell me they breathe more comfortably simply by adjusting how they sit or stand. Rest and sleep are just as essential. The lungs and immune system do much of their work during rest. Poor sleep can make breathing feel more labored the next day and can heighten sensitivity to normal sensations. Protecting rest is not indulgence. It is part of good medical care, especially as we age. Routine ties all of this together. When days follow a familiar rhythm, the body establishes a baseline. Against that baseline, real changes become easier to recognize. You notice if walking feels harder than usual for several days in a row. You notice if fatigue is lingering rather than lifting. These observations arise naturally, without scanning the body or waiting for something to go wrong. This is one of the reasons routine reduces fear. When the body feels familiar, change stands out calmly instead of dramatically. Seniors who maintain gentle routines often describe feeling more confident about their health, even when they are aware of potential risks. From a medical perspective, this kind of awareness is incredibly helpful. It gives doctors clear information rooted in daily life, not anxiety. It also allows seniors to remain engaged and independent, trusting that meaningful changes will be noticed and addressed without panic. Daily habits are not about control, they are about cooperation with the body. When routines support breathing, rest, and movement, respiratory health becomes part of life, not something to fear. That steady partnership allows seniors to live fully, breathing with confidence and calm. Respiratory awareness in dementia and memory care. When caring for someone with memory loss, awareness of breathing must be handled with special gentleness. In dementia care, the goal is not only to notice physical changes, but to protect emotional safety at the same time. I have walked alongside many families in this space, and I know how easily concern can turn into tension if we are not careful. People with memory changes may not be able to describe how they feel in words. Breathing discomfort may show itself through restlessness, facial expressions, changes in posture, or withdrawal from usual activities. These signals are often subtle. They do not announce themselves loudly, and they should not be chased with urgency. Quiet observation over time tells us much more. Caregivers sometimes feel pressure to monitor constantly, worried they might miss something important. In reality, calm presence is far more protective than constant checking. When a loved one feels watched or corrected, anxiety can rise, and that anxiety itself can make breathing feel more difficult. A settled environment helps the body remain settled too. I often encourage caregivers to observe breathing in the context of comfort. Is your loved one resting peacefully? Are their shoulders relaxed? Does their breathing appear smooth when they are calm or engaged in something familiar? These moments offer valuable information. Changes that persist across different settings and moods are more meaningful than brief shifts during stress or confusion. Routine is especially important here. Familiar times for meals, rest, and gentle movement create a rhythm the body recognizes. Within that rhythm, changes stand out naturally. A person who usually naps comfortably but begins waking breathless or unsettled may need attention. A person who normally enjoys a short walk but now avoids movement may be signaling discomfort. These patterns guide care without causing distress. Emotional safety must remain the priority. Reassurance often matters more than explanation. A calm voice, familiar touch, and unhurried presence help regulate breathing more effectively than repeated questions. Even when memory fades, the nervous system still responds to kindness and steadiness. From a medical standpoint, caregivers play an essential role by sharing observations of daily comfort and function. Doctors do not expect you to diagnose or interpret symptoms. Describing what has changed from a loved one's usual pattern is enough. That information fits into a larger picture of care. Respiratory awareness in dementia. Care is not about vigilance. It is about attentiveness without fear. When caregivers remain calm, breathing often remains calmer too. This approach protects dignity, preserves trust, and supports the well-being of both the person receiving care and the person giving it. In this space, patience is not passive. It is active protection. Through gentle observation and emotional safety, caregivers help create an environment where the body can breathe more easily, even in the presence of memory change. The role of medical systems and monitoring. One of the most important reassurances I can offer is this: seniors are not meant to track respiratory risk alone. That responsibility does not rest on your shoulders. Modern healthcare systems are built to monitor, observe, and respond quietly and carefully, often long before a problem ever reaches daily life. In medical practice, monitoring happens at many levels. Physicians follow established guidelines, review patterns across large groups of patients, and stay informed through ongoing research and public health reporting. This work continues in the background whether or not you are thinking about it. When something truly requires attention, guidance becomes clear and specific. Until then, the absence of urgency is a sign of stability, not neglect. I have met many older adults who felt they needed to stay constantly alert, as if missing a detail could put them at risk. That belief often comes from hearing messages that emphasize personal responsibility without explaining the support already in place. In reality, healthcare is a shared system. Doctors, nurses, laboratories, and public health professionals work together to notice trends and changes that no single person could reasonably track alone. For respiratory health, monitoring includes watching patterns over time. This may involve routine checkups, listening to changes in breathing during visits, reviewing oxygen levels when appropriate, and considering overall function. These observations are placed in context with age, medical history, and daily life. Seniors are protected by this layered approach without having to actively manage it. Caregivers often feel an even heavier sense of responsibility. I want to reassure you as well. You are not expected to replace medical systems or make complex judgments. Your role is to notice changes in comfort, participation, or routine, and share those observations calmly with a healthcare provider. That partnership is enough. Public health monitoring also plays a role. Rare conditions are tracked quietly at a population level. This allows professionals to recognize concerns early and respond thoughtfully. Seniors benefit from this vigilance without being burdened by it. Understanding this can bring a deep sense of relief. It allows you to release the pressure of constant vigilance and return to living your life. Trusting medical systems does not mean being passive. It means recognizing that care is already in motion, guided by experience and evidence. You are supported even when you are not aware of it. That support allows you to focus on what truly matters. Enjoying your routines, staying connected, caring for yourself and others with calm attention. When healthcare systems do their work quietly, seniors are free to breathe more easily, both physically and emotionally. Trusting the body while staying engaged in life. As we reach this point, I want to return to a message I share often with my patients. Awareness is meant to expand confidence, not shrink your life. Understanding respiratory risk should never make you feel smaller or more cautious than necessary. It should help you trust your body more, not less. Over the years, I have seen how easily older adults can begin to pull back when health becomes a frequent topic. A walk is postponed. A social visit feels tiring before it begins. Daily activities start to feel risky rather than familiar. Most of the time, this retreat does not come from physical limitation. It comes from doubt. When trust in the body fades, independence quietly follows. The body, even as it ages, holds deep wisdom. It communicates through patterns, not surprises. When you understand how doctors observe breathing calmly and over time, you no longer need to treat every sensation as a warning. You can notice how you feel without fear. That kind of listening strengthens confidence. Staying active is one of the most reliable ways to support respiratory health. Gentle movement encourages fuller breathing and keeps muscles flexible. Activity does not have to be demanding to be meaningful. Walking, stretching, gardening, or moving around the home all remind the body that it is capable. When movement remains part of daily life, breathing often feels more natural and less labored. Social connection matters just as much. Conversation, shared meals, laughter, and familiar faces support emotional health, which in turn supports breathing. Loneliness can make the body feel heavier and the breath more shallow. Connection often brings lightness back. Seniors who stay socially engaged frequently report feeling more energetic and more at ease in their bodies. Trusting the body also means respecting rest. Engagement and rest are partners, not opposites. When seniors allow themselves to rest without guilt, the body recovers more fully. That balance between activity and rest helps breathing stay steady and responsive. From a medical perspective, engagement provides valuable information. When you remain involved in life, meaningful changes become clearer. You know what feels different because you know what feels normal for you. This clarity supports timely care without creating fear. Independence does not mean ignoring change. It means adapting calmly. When seniors trust their bodies, they seek guidance when needed and continue living fully the rest of the time. That balance protects dignity. Awareness should make life feel wider, not narrower. You deserve to keep moving, connecting, and enjoying your days. When knowledge is paired with trust, seniors breathe more freely and live more confidently. That is the heart of healthy aging, staying engaged with life while knowing you are supported every step of the way. As we come to the end of this conversation, I want to slow everything down and thank you for staying with me. Taking the time to listen and understand is already an act of care. Learning about respiratory risks is not about fear. It is about balance, Stees. Knowledge is meant to bring calm and clarity, not keep the body in a state of alert. For older adults, there is no need to change how you live your life. Your body responds best to steadiness. Familiar routines, gentle movement, nourishing meals, and emotional safety do more to protect your health than constant vigilance ever could. Breathing becomes easier when the mind feels settled, and the body often follows that lead. I want to speak directly to those of you who care for someone else, especially a loved one living with memory changes. Your presence matters more than you may realize. Calm observation, patience, and reassurance are powerful forms of protection. You do not need to watch every breath or anticipate every change. A steady tone, familiar rhythms, and kindness create an environment where the body and mind can feel safe. It is also important to remember that you are not meant to carry health concerns alone. Medical systems, professionals, and communities exist to support you quietly and carefully. You are allowed to live your life, stay engaged, and trust that meaningful changes will be recognized and addressed with care if they ever arise. Senior Health Daily is here to be a quiet and reliable place you can return to whenever health information feels overwhelming. There is no rush to understand everything at once. You are not behind, and you are not alone. We will continue to walk through these conversations together with patience, respect, and compassion. Thank you for sharing this time with me. Take a gentle breath, trust your body, and remember that understanding grows best when it is given space, kindness, and time.